one you want to trial put in. Okay, and hit search. I'm pretty sure that one's not going to be in there. So it's bringing up Medicare, so it's not going to be there. So you're going to want to go back to Medicare is not Medicare for you guys, right?
Correct.
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 The private insurer.
Yeah, so reset that. And let me make sure, in your drop down box, yep, you're on home care design. So, yep, perfect. So search again.
Is it any one of those in here, you think?
Is Medicare in there? Yeah, you can click on Medicare if you want. Or UCare
No.
probably is not in it. So now click down below where it says click to add payer. Click here to add payer. That's where I was trying to get you to. Okay.
I mean,
So
you don't have basic insurances in here? That's
No,
pretty...
it's just in this module.
So let's just say this. The system comes with Medicare, but it's not going to come with the other insurances because your contract with UCare might not be the same as another agency's contract.
Okay.
So so when you go on the system, we're going to handhold you and put in all of your payers with you. And from your payers, we build your e-billing template. So,
okay. So I'm going to interrupt you. We had nothing, like our current software system, Cache, did all of this for us on the back end. We actually didn't have to do much of that. So we're going to really need hand-holding from you guys.
absolutely.
If we do forward with you, giving you access to what we have currently set up. But I mean, to be honest, like when I see like GL code, that's foreign to me. I don't know what that even means.
Yep.
Okay.
We're going to handhold you the whole way. And GL code just means that if you guys close out your books and you want us to interface with your books so that you can, they can run GL reporting off of, that's why that exists in our system today. So this is definitely something we 100% walk you guys through because we want it right, and you only do it one time per payer, right?
So set up UCare. So this essentially gets it now so we can bill obviously to UCare. Yep. And then will this allow, do you guys automatically pull the 835s then for all UCare remits that come under associated with us, or how does that work?
Yes, so it depends if you add Availity on. If UCare uses a clearinghouse, that we can do that. Otherwise, you just upload them into the system. And when you upload the 835 in the system, we're going to give you what all of those, we're going to auto apply it when the 835 is uploaded. So either it's an automatic upload or you guys upload the 835 and the system will auto apply it.
Okay, and let's just say I have 3 UCare, 2 United, 4 health partner remits that I'm all gonna just go in here and post.
Yep.
And so will I get an exception report for each of those?
You will. You'll actually apply it in our system. When you post the 835, when you add the 835 to the system, each invoice that goes out of our system has a unique identifier number. So when you upload that 835, it automatically applies the payment correctly to that 835. So if there was an underpayment, an overpayment, it didn't recognize it, you're going to see all of that on the screen immediately on that 835 screen, so that you'll know exactly, and you'll be able to say, okay, this I need to, I want to rebill it to the secondary payer. I want to put it on hold till I research it and figure out why they underpaid us. You have all that ability to do that in our system.
But how does that look? Like, is there like a report we can?
It's an aggregate number, or do I have line by line?
Let me share my screen because I think you guys are going to get more at this point. Hold on, let me get my demo system up.
Yeah, I think clinicals more going to probably want to see this side, but I think for the billing side, we're going to more want to see your screen. That sounds good.
Yeah. Okay. All right, so let me bring up so I think you guys can see my screen now. Okay, so let me go through everything so that it kind of makes order, and then you guys stop me, right? So
Okay.
when we set up your payers, and again, you guys just get your payer list for us. We're gonna then walk you through it hand in hand. Let me bring up like Aetna. Let me bring up Aetna. Okay, so we're gonna get that demographic information that we need in the system. So we get the demographic information, and then from the payer, we have a plan. So you guys, that allows us to copy from one business unit to the other. So if you guys expand your business, you open another office, you want Aetna to be in both of those offices, because we have it as a payer, the payer allows us to copy it. You then can have multiple plans under a payer, or you can have one plan under a payer. So if you had, for example, if this was Humana and you had 3 different plans under Humana, Humana Gold, Humana Blue, Humana HMO, you can have multiple plans connected to different NPIs up under payer. Does that make sense?
Yep.
Okay. Then from the plan, we go to the group. And again, you can have multiple groups up under that. So if you have Humana Gold or Aetna, and you have 3 different Aetna plans you're billing, you can add as many groups under that plan as you need to add in our system. So I think starting out, that's what makes our system really unique, is that it really allows you the ability to put on what you need to put on.
Yeah, Kathleen, let's just assume that we're all done with that.
Okay.
How does 835 look like to get when it's uploaded? What exception report am I seeing? Do I have line by line visibility? What's the claim management side where it goes and posts, where I can go look at line by line error codes so I can follow up? Do we have?
So I'm going to show you one that it sits in our system. We have to put these in our system because we don't have the ability to send out an 835, but this is the way it looks. When you upload your 835, it's going to give you that invoice number and let you go down to each unique line item to see if it applied. If it didn't apply, if there was an issue, again, like I said, you have the ability to put it as a write-off, a sales adjustment, a payment, however you want it to be. So you see it right on the screen. You don't have to run a report. It sits here. If you have any unidentified invoices, those sit on our 835. If you have any denial notices, those sit on the screen as well.
But okay, so for example, we bill MA every 2 weeks, and we send out, let's just say $300,000, and we get back like, let's just say 50,000 of rejections. I mean, that's a lot of individual claims. So you're saying we have to look through the screen at every individual one?
No, so let's talk about rejections. So why are you getting rejections?
Multiple reasons. Maybe they're out of units. Maybe we didn't have off for it.
So our system is never going to let you send those out. We're going to keep everything that is out of,
because otherwise we can get timely filing.
Our system will send out an invoice to meet timely filing, but it is not your true billable invoice. We have a report that's called an unbilled reasons report. So the system, when you go to bill, is not going to send out anything that is not truly billable, because you don't have an auth, you don't have a doctor's order, you don't have primary diagnosis, whatever it is. Let me do this summary total.
Okay, so what about this? A PCA does services for a client. We have to have their UMPI number until we can get paid. But sometimes their UMPI numbers are a month or 2 months behind. You're saying it would not bill until we get the UMPI number, right?
It'll hold it for you, yes. Everything that you say you have to have in place, we hold in the system. It sits on an unbilled reasons report, and it's going to tell you why it hasn't billed.
Okay, so that's
Right.
fine, but back to the question about all the rejections, that makes sense for that, but what if we didn't know that we ran out of units or something like that?
You will know in our system that all sits on the calendar. So when you have a schedule that no longer has an auth that covers it, you can run
Allison, chime in here about that?
So I do have a question. When we bill PDN services, for example, we're billing RN and LPN on the same claim. So there
Yes.
might be a situation where I'm one LPN unit short. Is it going to hold that whole claim? Because I would rather everything else bills and pays, and then when I get that one unit, I can rebill
It only holds what's out of auth. So on Sherry, if she has 12 services and only this day is out of auth, it only holds that day. It's not going to hold. So on that unbilled reasons report, it shows by day what's being held. So if you have one visit that's out of auth for an hour, it's only going to hold that one visit for you. It's not going to hold the rest of your
But
billing.
we 24 hours in a day, so it's billed 23 hours and holds 1 hour?
Nope, it'll hold the whole shift. That one
That's
shift.
asking. We don't like that. So is there a way around that? Because now I didn't get paid on 23 hours and I just have to wait till, maybe the off's gonna take months until I get it. I
Right,
need
you
my
end up with
money.
a cash flow issue with what our 24-hour
You
vendor.
guys can choose to override it. You have the ability in our system to remove the schedule issues and to bill it if you choose to do that. That's your decision as an agency.
And if we do choose to do that, is there a way then for us to edit and rebill the claim that was previously submitted?
Yes, you can always rebuild the claims in our system.
Okay, and so right now we use Availity and Zermid for our remits.
Yep.
I've seen a lot of companies, so I can't remember what do you guys use for the clearinghouse?
If you want our automatic billing, that's through Availity. So when you hit post billing, it auto sends them through Availity. That's also where we do our eligibility checks as well, is through Availity. So we send out the 270. If the 271 comes back saying that client no longer has that insurance, that shows up on the eligibility checking.
Okay, can you tell me this? So we submit a claim and it comes back and let's just say it partially pays, but we have a lot of clients that owe a spend down or like a client deductible. So let's just say it's a $100 claim and insurance pays $20 and the client owes $80. Does your system automatically generate an invoice or how does that work?
Yes, you can set it up in the system. We have primary and additional primary, so you can set it up in the system that if they owe that it will send out that secondary bill with what they owe. Yes.
So what if we don't know we don't know when a client is going to have a spend down or not?
I'm not sure how we would know if you don't know.
Well, MA gives a code, and if it's a certain code, listen to what I'm saying. If it's a certain code on a remit, that has to be generated as an invoice. I don't know how Cache is set up, so they can't do that then. So spend down invoices can't be generated.
We can generate a spend down invoice, but you're going to have to set up the system that if it's not paid, it bills the client.
Yeah,
right?
And as we said earlier, we'll help you with each one of these special payer setups. I mean, we understand that's what we do as part of our discovery before we get started. Understand how you're currently working, what needs to be set up, and then we'll work with you to set everything up.
I understand that, but I have to make sure before I go forward and sign that 100% you guys can do what we need it to do. Because like I said, we've been meeting with several companies. Yep. And the last one that we met with couldn't do basic stuff that our current software could do. So that's why we're asking these questions that I would think would be generic and everyone would have, but we found out a couple weeks ago that that wasn't the case. So that's why we're asking.
I totally understand. And as Kathleen is saying, we can do that. So what else we can do to help prove that to you. I mean, if we need to do more.
We're
We don't
reading the
know.
835.
We
The
don't,
way Cache works right now, I have to manually
I
say,
don't know.
read the
I don't know if
835.
this is on.
So I'm seeing if Scott Brashears can jump on the call because he can answer that, but we do spend downs in other agencies, in other states. So, you know, he's on a call right now. He'll join shortly, but I don't think the spend down, when you're asking me that you don't know about what the spend down limit is, there's got to be a way for our system to know that, right? But let's let Scott get on the phone. And
I think Stephanie's just a little mistaken on what the process is. The way our process is now, I have to manually click on a button that says read the 835 and generate the spend downs. That's a manual process. What's nice about it though is I can import 5, 6 different payers and remits, and then I can click create spend downs and it'll read all of them across all those payers and give me a list that I could print.
Right. Yeah, and on the discussion that we had with you, Tony, and Allison, I believe on the last call with Scott Brashears, we did touch on that. So just give us a minute. Scott is going to join here in a second, and we can complete that. You want to move on to something else real quick, and then we'll circle back to this?
So basically, Scott says you set the spend down on the payer, that they have a spend down, and then on each client, you set it in the episodic billing codes that there's a spend down, and then it knows to send that invoice to the client during that spend down period if it hasn't been met.
Yeah, the private insurance aren't going to work that way.
Well, let's wait until Scott gets on and then he can answer that for you.
Okay, that's fine. Can you, while we're waiting?
When you're saying private insurance, are you talking like long-term care insurance?
I'm talking like Medicare, UCare, Health Partners, just the private.
Yeah, we have some big agencies in Connecticut that do
They're
spend
not episodic. It's not episodic.
Yeah, it's when I'm saying episode billing codes, I'm not saying it's episodic. I'm just saying that that's where it sits in our system.
Well, that makes it confusing because Medicare we have to completely treat, and Optum and some VA now we have to completely treat as a separate beast. Through episodic.
That's all right. I'm sorry, I didn't mean to interrupt. That's all handled on the group bill rules. You say it's if you now have to do that episodic. But you don't have to do the notice of admission. You just set that up on the payer and it will bill episodically versus billing it as a fee for service.
Okay.
So while we're waiting, can you show me like how your like outstanding claims tables will look?
Yep, so that's our collections. So it's the collections home. We'll tell you the first page, if you say that you're on your payer, you say, hey, we normally expect payment within 20 days. If you don't get that payment, you will get an automatic payment overdue alert to let you know on that invoice or multiple invoices that you did not receive the payment when you expected to. There is an aging that sits in the system and it goes by payer, by facility, if you do any facility staffing, and by individual client. If you click on that payer, when you click on that payer, let me just go to Medicaid, for example, it's going to have all of the contact information on it, any custom comments that you've added. If you have an overpayment amount that sits on the payer, it'll be there. You can search by invoice or payment. So if the UCare is telling you that they paid you on invoice number such and such, you can go in and choose to look at it that way. You see your bucket amount.
Yeah, can you just, is there just like a claims table that has all the open claims?
Yep, right here. Gives all the open claims and how much under each claim is open. So you're going to want to work the ones up here versus the $4.50. If you open that up, you can see every claim that makes up that balance. You have the information for the client right at your fingertips, their subscriber number, date of birth, everything that you would need while you were on the phone with them. You can drill down into every line item to see what exactly makes up that claim. You also can add a payment alert that says, hey, you spoke to this payer, they expect you to have the check next week. If you get the check, it'll automatically remove the alert. If you don't get the check, it's going to alert you that you haven't been paid.
Can you manually post payments?
Yes. Can manually post payments in the finance block. You will see that you have the ability to post payments by payer. You can do a batch payment posting.
Can you go to that post payments by payer?
So this is bringing up my CompNet, but you can search by business. So I've got it show only outstanding. So that's why it's showing me the invoices that are outstanding. So I then can choose the invoices that I need to post. You can reverse, you can do take backs. Questions?
Like aging or whatever.
Yeah, they already showed that. Yeah, so because we like the way that it works right now, like I have so many manual postings that I have to do after importing the 835s because the amounts don't match up, or it was a rebill and sometimes it errors out and it won't find it. So do you, like, if there's a partial payment, like, do you have that issue where you import the 835 and there's things that err out and that would need to be manually applied to the claim? Is that something that's happening with your?
Not in our system, because again, you can kind of, when I go back to this one, if there's a problem on the claim, then you say, hey, I need to rebuild this, or I'm going to put it on hold, or I'm going to write it off. If you choose to rebill it, it's going to ask you which payer do you want to rebill it to. It'll bring up the payers on that client so that you just check the payer that you want to rebill, or secondary bill, or rebill it again. So no, we don't really have that problem. You will have, and it goes to the fact that each invoice, we create a unique identifier number. So when that payment comes back in, we're looking at those invoice numbers to match those payments up with, right?
Right, and the ones that are no auth or out of units or what have you, they're getting held anyway, I guess, till they're fixed.
Correct. And it's automatic. So let me just explain that process. I'm sorry again to interrupt. It's automatic in our system. When you go back in and put the auth that you just got on that client, it is automatically going to release when you bill the next time. It's automatically going to release all the invoices that auth covered. You don't have to go back in and rebill it. Our system automatically does that for you. And so you will be able to run a report that's the unbilled released. So you'll know, hey, this billing cycle, we released $5,000 that was sitting waiting on authorizations. And because we got those authorizations in the system, that billing has now been released. So that's
it'll release like that same day.
If you generate billing that day, it will. If you guys generate your billing once a week, then it's going to release once a week. But whenever you do billing next time, after you've put in that authorization or the doctor's orders or the diagnosis, whatever was holding it up, it will automatically release that billing, and it will sit when it releases it on the unbilled release report. So it'll tell you, hey, this is everything we released, and this is how much that amounts to.
Okay, Allison, questions about that? Because I know right now we're billing as we get off, right? Or are we waiting?
I was actually just going to ask a question. It's a little bit related. when let's say we bill 8 hours for a nurse that worked a shift, and then we find out she actually left an hour early and mischarted, what does it look like to actually go in and edit that claim and resubmit it? Because
So
right now, those are the things that aren't correctly posting in our current software, and there's a lot of kind of manual labor to get the claim corrected.
yeah, so that's the edit 2.0 in our system. And I'm not the best at this because I'm a nurse and Scott's the finance guy. But you do have the ability to go into the actual invoice. Let me see if I can find the invoice. You actually have the ability to go into that invoice and edit it. So you're just going to lower the units and then send it once you edit it. Does that make sense?
And when we do that, then it still comes in on the 835 and posts automatically?
Yes, yes, because you really want to get the invoice right before it ever goes out, right? So yes, it will come back because it's still that same unique invoice number, right? The invoice number doesn't change. You're just editing the units on that invoice, correct?
Yes.
Yep. So that's the way it works in our system, is that you have the ability to go in and edit those units and edit that invoice. When you edit that invoice with that unique identifier number, when it goes out and the 835 comes back, it's going to attach, even if it's taking back money, it attaches the 835 in our system and it automatically adjusts that invoice correctly for you.
Does that make sense to you, Allison?
Yeah, I mean, I would like to see actually how you are manipulating the claims, but
Yeah,
I realize it's kind of hard in the, this mode that we're doing here.
yeah, and I apologize because I don't have one set up because I've got a demo after this that I saved, but billing adjustment 2.0, here we go. All right, so let's search for payer. Let's do in this date range. So let's go back to January 1st to, okay, let's search and see if I can find one. All right, let me do it by Medicaid. I think we might find one that way. Again, I'm in a demo environment, so we don't always send out invoices. Jim, he's not Medicaid.
And you can, or just kind of doubt at how close we were to this other company, and they didn't have a lot of this, so that's why we're like, we specifically see it because.
Yeah, I get it. I totally get it. Let's see. Let me see if I can just put all select. Let's see if I can search and find one. Last week. Mistake. Oh, let's see. Oh, never mind. Incomplete adjustments. Here we go. All right. So let's see. I can click on this invoice. It helps if I'm looking at the right thing. So it's Blue Cross Blue Shield. So that's how I can. So then I can come over here and save that. So then I'm going to go over here. I can enter comments. And then I can adjust the units. Let's see. That one I just did a billing adjustment. I'm sorry. Okay, wait, let's see. Oh, that's because there's one already on here. So let's see if I go here. Blue Cross Blue Shield save. That's the payer. All right, let me try another one. Hold on. So this one, adjustments. Oh, so this one did. So the schedule time has been changed. So this one, you can see where it was done. It was 9 to 11, and now it's 9:05 to 14. So they adjusted this one on the billing 2.0 to be more hours. So Scott will be able to show us for sure if he joins, but yes, you have the ability to come in and adjust off of it, preview what you adjusted, and then commit it.
So anytime a change is made in the scheduling, it would show up in this adjustment as something that needs to be rebilled.
Well, so what we basically say in our system is we don't want you to have to adjust it in billing 2.0. So our payroll and billing are attached together, right? And so when you post payroll, and you could post payroll every single day but not pay, but once a week, every 2 weeks, but that allows you to bill every day. If something's wrong, we'd rather you go back, unpost it, and fix the schedule so you're paying the employee right as well as billing correctly, right? So as long as you've done all of that before you post billing, then it will automatically correct the invoice. You don't need to use the billing adjustment 2.0. It's only after you've posted the payment that you would need to come in and do the billing 2.0, or if you've already paid the employee and closed out payroll and you want to do the billing 2.0 just to adjust down what you billed or adjust up. So our preference is that you always fix the schedule, which fixes it. Does that make sense?
Yeah, I think in a perfect world that would be, you know, our
absolutely.
preference too, but sometimes we don't even catch that things are wrong until an employee got paid wrong.
Yes. So that's where you just come in and do the billing 2.0. And again, we can get Scott on another call if we need to, so he can walk you through that and through the spin down. We're happy to do that if he's not able to join today.
Yeah, and maybe that's probably something we want to do.
Yeah, I
two
agree.
two other ancillary questions here. Is Medicaid through Availity with you guys too?
It depends on the Medicaid. You guys are in Minnesota, right?
Yeah, we're a different beast here. We go through minutes to get the 835s.
So those you would just download onto your hard drive and then upload. You can upload them into our system and it's still going to read those, right? So you can see where you can upload the 835. So if you have payers that don't go through Availity, which Availity will kind of intertwine together.
Yeah, no, you can go back and forth.
Yeah.
It's just a matter of
Yeah.
whatever, going through
Yeah.
the process of having it show. I just didn't know about Medicaid because we've always gone through minutes, and our software now goes and grabs that for us and posts it. So I didn't know if that changed or not. I was
Yeah,
curious.
I can look. Yeah, I'll look and let you know for sure because we have the Availity list. So David or I can look that up, and Scott probably knows off of the top of his head. So if we set up a call with him just to go over spin down and editing of the bills, and I apologize. Yeah, he's the finance, I'm the nurse.
My other weird question is we recently started mental health therapy.
Yeah.
And our therapist we have on staff likes her system that she bills through. And so it's not in our claim management side right now, but it pays through the remits with everything else. So if it's a UCare, it's a code that's just going to spit out and not pay. And then I have to book it manually on our end through our QuickBooks. How would that look? So if it's a UCare payer, all of the nursing services or clinical services would post and be in here, but then there's this mental health code. Is that going to show up somewhere where I can see it?
Well, you could always, are you scheduling it in your software today?
No, it's everything's separate in a software called Therapy Notes that's just more tailored for therapists, whereas our current software has no really ability to handle the notes and the way that it needs to bill. And so it's kind of turned into a separate deal. And not a lot of home healthcare companies are doing therapy. So there really isn't a lot of, it's just not something that's connected right now. But it does pay with everything else. Obviously it just airs out we get an exception report. When I post 835, everything that doesn't post the full amount or pays zero, or they can't find the claim, comes up on an exception report. And then when I go to book that in my QuickBooks, I can take that out and separate that revenue separately.
So you're gonna still see it here, right? Because you're gonna see it in that unidentified invoices.
Okay, and
So
that's
you'll
gonna go,
see the
hey,
payment.
here's a code or
Yep.
a claim that's
Yep.
not in here, or.
Correct.
Got it.
Correct. Yep. So it'll
Okay.
still show on that 835. Correct.
All right. Yeah, I just wanted to ask those two as they came across my mind.
Yeah, and I'll have David get with Scott. I'm sorry, I apologize. When you go real deep in finance, I'm not that person because I'm not the accountant, and I want you to
you know,
have the
and
answer.
it's maybe a blessing that what happened to us happened as we were kind of just floating on the lines of we'll figure it out, and then I just asked one question that kind of led us down a rabbit hole of asking specific questions, and they're like, yeah, we actually can't do that. But I'm like, okay.
Yeah. We're billing spin downs. It's easy to edit invoices so that you can adjust those units and send it out correctly after the fact. We will set up a call with Scott just for him to show you those two things. And then if you guys have any other real technical questions around finance, Scott's the guy to talk to.
Awesome. Yeah, I really appreciate it. I know that it seems to just go a little bit sideways as we get specific with whatever. And I think in a lot of ways, we're just used to doing a lot of manual things and seeing it a certain way.
Oh, absolutely.
Our
Yep.
current system. So it's just a matter of kind of organizing it in our brains and making sure the pieces are there. And so seeing it specifically with some of the stuff would be really nice.
Yeah, and we'll set that up. Not a problem.
Yeah, absolutely. And we want you to know that you know before you sign with our system that it can do everything you need it to do.
Yep. And obviously we got to where we got to because from a clinical perspective, the real heart and soul of the business is just so inefficient and convoluted and missing a bunch of pieces. And so I know that you guys have that. It's just making sure we can tie everything up on the back end and it's all there. So.
Yes, and I just did text Scott and he said he'd be fine to jump on a call with you guys. So we'll just let David see what time works for Scott and you guys and have him go through the spin downs and the editing of the invoices so you guys feel comfortable. And anything else, if there was anything else, add to that list, Scott will show you.
I do have a quick question before we switch to more clinical things. I believe we saw this in a demo, but to be honest, I've just seen a lot of demos. Can you really quickly show me what episodic billing looks like? Like the Medicare process? Yeah.
So our episodic billing sits in, you mean for billing or do you mean for nursing? You mean for billing, right?
Yes, for the billing part.
Okay. So in the finance section of the system is a section that is called the episodic queue. And the episodic queue will automatically generate for your wraps, your finals, your follow-up finals, your non-discharge, and your notice of admission. And I have no notice of admission because mine are going out the door with right away whenever I'm completing an assessment. So I really probably need to create one that I don't do a plan of care that just sits here so you can see it. But it will show you the notice of admission. They will sit here until they've gotten that verbal order date, until they've started the OA assessment, and you've admitted the client. When you've done those three things, it will automatically send those two 30-day wraps out the door for you. You guys set up on the Medicare payer what you want the default HIPS to be, because again, you're not going to have your OASIS finished in time for this to go out the door. So we do, to give you revenue, say, what is that default you want? We true that up for you automatically when you do the EOE. So on each of those, it is going to tell you on the initial, you cannot check things in here that to get the wrap to go or to see those, they have to be green. And so really the wraps don't matter so much. It's really those finals, right? In our system on the finals, let me go to non-discharge final. I have a lot in here I need to get cleared out. So in our system again, for my final to go out the door, these are all the things that Medicare says have to be in place for you to send that discharge final. So we're not going to let it bill until you've fixed each of these in the system, and it's a hyperlink where it is that you need to fix. So you see it saying all schedules are either verified or canceled. If you look up here, you can see I have pre-verified and I have a bunch of scheduled. So I need to get all that fixed. When I click on it, it will take me where I need to go. Personally, when I was on the system, I had clinical and finance both in the episodic queue, because there are things you need your clinical people to fix and there's things that the billing needs to fix, correct? Once this is all green, it will bill automatically at 10 and 4 every day. So when you have all green checks and you need your wraps and you need your notice of admissions and you need your EOEs to go out the door, it's automatic in our system. You don't have to hit anything to bill a claim. We will let you know if you have recertifications that are out of window, so that your clinicians didn't do the recertification at the time they should have done it. So it's going to tell you, hey, this was a late assessment for cert period number 2. If you have any visits during that first day of the cert period and when they actually did the late assessment, it's going to automatically make those visits non-billable for you. Our system really just does everything for you to make it super easy. When you have a final, there is the ability to QA it before we send it out the door. So you pick the discharge reason and you say, hey, we've QA'd it. It's now ready to go. You just hit update status and that will bill automatically for you as well. It will tell you if there's a change. So if your HIPS code at the beginning and your HIPS code at the end, if there was any difference, either negative or positive, you will see that here on the episode. If you have late schedules, that's kind of telling you, hey, you made the discharge date on the 12th, but the client actually had a visit on the 13th. Are you sure you want to send this claim without that visit being a billable visit? You have the ability to go in and look at the episodic claim history, so you can look to see the status of the claims in your client. So what was billed, how much was billed, was the final billed. You can see mine are deleted because we don't send those out the door. But you have the ability to see everything that was billed and what you're getting on that individual client. And you can do episodic billing on demand. So once you do episodic billing on demand, if you have a particular client, or if you decide, hey, it's noon, we have 20, they're sitting waiting, we just gonna bill all of them. You just help bill DPS and it's gonna send them for you. You don't have to wait. That one I know pretty good.
Yeah, thank you. That was helpful.
Any other questions?
I don't have any more. This is Stephanie. If you can just, so is Scott going to reach out to me to schedule that follow-up call?
Yeah, no,
David?
David will.
I'll coordinate that with Scott and get some best times for you guys. As soon as you're available, I'll get your next available time and see if that can match up.
Okay, David, if you can, this is Stephanie. Do you have my email?
I do not.
Okay, same as Gretchen's, but it's S. Johnson.
Okay, got it.
S. Johnson at regencyhhc.com. If you can coordinate with me so we can get that scheduled. I don't think we have any more questions. I guess we will with Scott, but I think Allison, Les, are you good?
Yep, I'm good, thanks.
So Gretchen, are you still on here?
Yep, I'm here.
Are you guys gonna jump into clinical then now?
Yeah.
Okay, sorry that took a little longer than I thought it would, but we really appreciate your guys' time.
Nope.
Oh, no problem. And I apologize. I couldn't answer those 2 questions, but we'll get Scott on the phone for you.
Okay, thank you very much.
All right, thanks, Stephanie.
You're welcome.
Bye, guys.
Okay, so do we want to give presenter to somebody else now?
Yeah, Gretchen.
Well, it's up to you guys. I'm fine too if you guys want to take
Navigate.
control of it. I just have some specific things I would like to see. Paul's here with me.
Okay, that's fine.
Or whatever you guys think is easiest. I'm just curious, I guess off the get-go, if we have a referral for like a PCA only client, there's no nursing involvement whatsoever, what would that look like from beginning to finish as far as doing an open?
So again, that's pretty much, you guys get the ability to choose. Well, first let's start with the forms, right? So you guys can put your form in that you use for your PCA onlys in. We have one that's called a start of care non-skilled, but it might be more than you want. So you can change ours. You can add your own form in. So the first thing we're going to do is help you get that start of care assessment in that you want. Then you're going to tie that in the system to a service type. That's what then will make it when your nurse, when you schedule that visit, your nurse has the correct form to fill out, right? Because you're probably not doing OASIS assessments on them, correct?
Correct.
So if you guys can create them however you want, but if you say, hey, it's an RN PCA assessment, in my case, it's an RN initial eval, you say, hey, here's the assessment that they have to complete, and it's required. So when you schedule that assessment visit for her, she's going to have the right paperwork to fill out from on the system. And let me just bring up my point of care for you. And so then when she fills that out, she also has the ability, let me move my box out of the way. She also has the ability then to create that paraprofessional assignment sheet for the aides for them to complete. So that can all be done on the point of care device. She will get that eval, and she will then have the ability on the client to create the care plan for the aides. And then it just depends if you guys are going to use point of care for the aides or not. If you use, Mobile Edge, if you use Mobile Edge, the task that the nurse assigns will populate on the Mobile Edge application for them. If they don't, so that she'll see her assessment here. She then has the ability to go in and create the care plan. So I can say, hey, this is for my PCA care plan, and this is the AM care plan. And then she chooses the task that that aide's supposed to do, so that you guys can either print it and give it to the aide, or if they're using Mobile Edge, whatever task she assigns on Mobile Edge will populate on the device for them to see. Does that make sense?
Yeah.
So pretty much when she completes this and signs and submits it and you approve it, the task that she chooses, and you guys have the ability to change these tasks to make them whatever you want. So if I say it's a partial shower and she needs to do that every visit, or let's see, she needs to use walker with ambulation. Once the nurse has done that, she saves it, signs and submits it. Then that goes to the back office, you approve it, then it populates on Mobile Edge, or it populates as a form that you can print and have in a client's home, however you guys choose to do it.
Okay.
So we'll actually, when we're working with you, clinically, we'll be going 2 different ways, right? What for Medicare, because I think you guys have some Medicare, right?
Yeah, most of our clients are Medicaid based, though.
Yeah, so we're gonna have just this little bit of Medicare, and then we're gonna get your Medicaid forms exactly like you want them. So any form that you're doing today, we want you to make sure that we include in the system that you have the ability to make it available as well. So if you have a falls form, if your client fell and you have them fill out a falls form, whatever, we're gonna work with you during that process to get all of that in the system. So whatever's scheduled, however you schedule it, that assessment is what form is going to populate for them to complete. And
Okay.
if you don't require plans of care on your clients, you just choose no plan of care, and it's not going to look at the plan of care for that particular client.
So can you set a system, it's by service type, like anytime I have a home health aid client, these forms are required?
Yes.
Okay.
Yep. So you would just set up and say, you mean for the nurse, correct?
Right.
Yeah.
Yeah, for the initial.
Yep, so you would just say RN homemaker open, and you put the form you want required on that service type. RN PCA open, the form you want on that. RN skilled nursing hourly, the form you want for that one. You have the ability to put all of that into the system, yes.
Okay.
As well as scan our own, that's our choice.
You can't scan yours in and it be available on Clinical Edge. You have to create the form, but creating the form is so easy. That's one of the things we'll train you guys on. We can put the forms in for you if you prefer us to do that. And then you guys just want the ability to change the forms. We'll do it either way, whichever way you want, but it's super easy to get the forms in. Once you get the questions in to the form that you want on your form, basically you just title your form whatever you want the form to be. Let me give it a second. So mine says 24/7. If I say I want to edit it, okay, now I want to create a new section. And on that new section, I want to have maybe the patient signature. I think if I go down where it says patient, so there, you'll already have some controls. Everyone that we've created in the system sits in there for you. So you can use some of ours, or you can use whichever one you want. But you can say, hey, this is a required question. So it means they can't complete the form until they've made that question. They've answered that question. I can name what the section is so that I can say this is the patient's signature. So you really, again, it's super easy. You get the form looking exactly like you want it to be. And then it flows to the Clinical Edge, from the Clinical Edge to the main application. So again, you require questions, so you don't have to necessarily review each one. So if we scroll down, you can add the patient signature. You don't have to require, you can require them. So most agencies on our system don't necessarily look at every visit note because they've required the questions the clinician has to complete. They look at the assessments and the doctor's orders if you have doctor's orders.
Okay.
Oh, good one. We didn't maybe even try to create like what it would look like.
So could we try to create a client folder?
Yes. Yep. We gave you the back office, and we gave you the back office, and we gave you a nurse.
Yeah.
So
Gretchen,
let me.
in the email that I sent you, Gretchen, there's an attachment that has the login and the password that you can use.
Okay.
Yeah.
let's see, Gretchen, David, can you make Gretchen presenter?
Sure. Okay, Gretchen, you can see a sign that says you are presenter.
Okay,
And then that way, if you get stuck, we can help you.
go ahead and hit share here. Here, Paul, do you want to do it?
Yep.
Start free trial.
No.
Oh.
No, you don't need to do that. You can get out of that and just go straight to the link that I provided for you to log in.
Yeah.
Yeah, it's my.continuelink.com.
Yeah, open another tab and then go to that URL.
Yeah, we're trying to open a link here, and it's just not going. Do this.
Yeah, you can open the tab there and start from there. Yeah. Yep.
There you go.
Oh. Yeah.
So go https:// : There you go. Now try and see. Are you in Chrome? Did you do it from the, David, you did it from the paper with no problem, right?
I did, but I got this at 1.2, so I don't know if you reset something.
Nope.
Okay. Hold on a second. Let me take a look here.
You know what? Yeah. Go into open up Internet Explorer and just open it in Internet Explorer and see if that works. Take the S out and I don't think that's right either. Hold on, let me.
Yeah, so I got to the login page. I just posted it in
The chat.
like you, Paul. I did a new tab, and then on the search bar I just hit paste for that URL and hit enter, and it took me right to the login page.
I just posted the link back in the chat too. You can try it that way as well.
There you go.
There you go. Now you can do sandbox 2.
Lowercase. Paul, you there? Gretchen, Paul, you guys there? Kathleen, can you hear me?
I can hear you. I don't know if his computer froze up.
I think we might have lost him.
Yeah, hopefully they'll join back in.
No. All right, let me
Can you try calling him?
yep, that's what I'm about to do here. Give me a second. Oh boy. Hold on, Kathleen. Let's see. You guys got hung or frozen or something?
Well, it shut off my whole computer when I clicked on the link. So we're trying to get here. Sorry about that.
I don't either, but I just wanted to make sure we connected. All right, we see your screen frozen, so I guess it'll refresh once you guys reconnect. Kathleen,
Okay.
I'll just give Kathleen control back, and then I guess we'll see when you guys log in, and then we'll start this again.
Okay.
So we're there waiting for you though, so just go ahead and log in. All right, thanks.
Thanks.
Bye. All right, Kathleen, I'm gonna make you presenter again, just so that we can clear the screen.
Okay.
Okay. All right, and then we should see when they get back in, I guess. Yay. Kathleen, I feel like I'm in Florida now. We got mid 80s weathers today, and this week mostly.
Nice.
Yeah, it's so funny. We go from 60 to 80 like overnight. This is crazy.
Wow.
Yeah. I'm gonna have to set up my satellite office in a minute.
Mm.
You know,
My granddaughter's got a travel ball tournament this week. I think it's supposed to be 90.
Oh my goodness. Wow. Well, you guys are used to that anyway, but I don't. We're in shock. I mean, everyone is. All this week is going to be mid 80s. So, like
Wow.
last week, it was mid 60s. So it's a shock for all of us. I'm not complaining though. I had to do some repair work on my sprinklers so I can get those going, but
Yeah.
just about got it so that I can at least get some green plush lawns.
Ooh, I got to get ready for your demo. I hope they come on.
Oh, I know, right? Hold on. Let's see. Did you have a good weekend otherwise, though?
I did, thank you.
Yeah. Yesterday was I had off yesterday, believe it or not. Yesterday was my wife's birthday, so we just took the day.
Oh,
Yeah.
that was nice.
Man, this chick got so many people that love her. I mean, the phone just would not stop ringing or text messaging, and
Oh, that's nice.
one of her clients brought her balloons the day before her birthday with a full cake.
Oh,
Yeah.
that was very nice.
Yeah, my wife is. I'm like, they're spoiling you. I don't know, man. She deserves it though. She's good people. You gotta be to be a nurse, right? You gotta have a good heart, man. So, she had a good day. Yeah, 2:30. Oh, okay, yeah. We got some time yet. What's going on, Gretchen? Let me check with her again. I'm gonna give her a call.
Okay.
Oh. Oh, okay. I just wanted to make sure. I didn't know what happened there. So you guys are almost there?
Well, my computer had to do a full reboot.
Oh, okay.
So, clicked the link and it all went black.
Oh, no. That's not the way it's supposed to work. But you're close though, so. No problem. Just wanted to check in on you. Kathleen and I are still there waiting. So
Okay.
I will see you in a few. Thanks.
Bye.
All right. They got a heck of a boot up process there.
No problem. Oh, at least they're sticking with it.
Yeah, I didn't hear any frustration except for on their own. So that's good.
Well, I think sometimes it goes with GoToMeeting, right?
Yeah, and especially if you have that many screens open as Paul was trying to do. I think it got a little overwhelmed, the system processing. Yeah, so for that billing finance part, I was actually hoping that Scott could be on. I mean, I was afraid something like that might happen. And he actually accepted, so I'm surprised. I thought he was going to join us.
Yeah, no, here's Gretchen. Hey, Gretchen.
All right, we're back.
All right.
All right, let's make you presenter.
All right.
Ah, good job.
All right. I'm just bringing up the chat again. Would you be able to send that link one more time?
I can. It's still in the chat, so if you click on the chat, you should see it there.
I think it restarted us. I did click on the chat. There's nothing there.
Okay, I'll resend it. Do you see it now?
Yep. All right. Gonna click again. When I did this last time, we left, so just heads up.
Close out of the GoToMeeting tab up top. You'll still be in GoToMeeting, but GoToMeeting sometimes. There you go. Perfect.
Got it.
you need me to put in the chat what you need to put in?
I think we're opening the email here on our other screen. We should hopefully one up and up.
Sandbox 2, all lowercase. And then demo 2, all
Okay.
lowercase. Okay, now hit sign in. There you go, awesome.
All
Okay,
right.
so now on the client tab, you're gonna go to Quick Intake Wizard.
Didn't go too far.
Go, yeah, it's a little bit more up top. It's like this second, third bullet. There you go, right. And just hit new referral, because we're gonna act like you're putting in a new client.
All right.
And yep, just choose, yeah, it's not gonna be yours, but you can choose anything you want.
That's what didn't matter.
Yeah, it doesn't matter.
That's like something though.
And then put in a name. Yep, and then client's name, whatever you want the client's first name to be, last name. And do you want this client to have orders or no orders? Do you guys want it assigned to a doctor or no? Did we lose them again? Did they freeze? Oh, you guys there? Did we lose you again? Oh, I think they need to close out of that GoToMeeting tab.
I don't know. I tried to text them through chat, but I'm not responding. I'll give Gretchen a quick call again. So got it.
Yeah, it might be easy. Okay.
Hold on.
Yeah.
This is Gretchen Falco, and then
Wow.
Regency, this is Melinda.
Hey, Melinda, David Thompson with Continue Link. I was on with Gretchen, but we got hung. Can you connect me with her, please? Oh, here, this is her calling me. I'm sorry. This is her calling me. Thanks, bye. Hey, Gretchen, David, I just called your office. Are you guys hung again?
Yeah, so also the second it's completely shut off my computer.
Oh, wow.
So we moved over to Stephanie's office.
Okay.
Over.
So what Kathleen was saying is that you could shut down that, there's a tab that's open. You could shut down that go-to. I don't know that it'll make a difference, but just try to clean your screen a little bit. There's a tab when you first log in that's a go-to meeting tab. You can just shut that once you're able to log in.
Okay. No, so Paul's in here on computer moving forward. Is that gonna screw up if I try to log in from my also?
Yeah, let's not do that. I know there's just one password, user ID and password, so let's try to keep it clean.
Okay.
If that's okay.
Yeah.
I'm puzzled as to what's happening on your end, though.
I don't know. My computer before, so I don't know if it's a fluke deal that something's on the fritz or.
It may. I've seen GoToMeeting do some crazy things. I don't know if it's related to that or not, but let's just give it another shot.
Can you see us right now in there?
No, I see your screen is frozen or hung. So, yeah.
Can you make me the presenter?
Okay, hold on. You know what, Kathleen? I'm going to give you back control again, Kathleen, and then we'll get them presenter.
Okay.
All right, hold on a second. All right, Gretchen, I see you. And that Kathleen, that's your screen displayed, right?
Yep.
You want to make Gretchen, is it you that's going to be the presenter now?
We'll make Stephanie the presenter.
Oh, Stephanie. Make Stephanie the presenter.
We just moved over to her office just to keep things moving.
Okay.
Hold on. Just
Don't see Stephanie? I'll make Stephanie presenter then, Kathleen. I got it.
Thank you.
Okay. Stephanie is now presenter, Gretchen.
Okay.
There you go. Oh,
Okay, there we go.
all right.
All right. So what I was saying is, do you want a physician or no? So I would just type in initial and choose one that's in there, but you can add physicians. Just so you see where it says add new physician, that's just telling you that the initial you're choosing, the physician isn't in there. So you can easily add it from that screen. Try choosing an A. Yeah, see if there's an A. I'm not sure how many physicians are in that one. Hold on, let me see if I can help you too. Let me see if I can find one. Okay, try using BE, Bethel, BE. There you go. Just make it a little easier, but it's easy for you to put yours in. So now you're gonna save that or go to next, either one, correct? You can just know that you can save it at that point. So put in your client's birth date. Up at the top, yeah. Okay. So you're going to want to go back up to the phone type and choose a phone type and put in a phone number because that's one of the things that's required. Yeah. And you could just make it, you know, home, whatever, and just put 11111 like I always do whenever. Yeah, there you go. All right, then you can put in any address. So if you want to use your work address, that's fine. And now you want to hit the verify button. That verifies. So now you're going to check that. So use this verified address. So if you use our Mobile Edge product, that's where it gets the GPS. Yep. And then you want to now add a contact person in below.
Or for like an emergency contact.
Yep. Yep, and then the contact type, and pretty much anywhere that there's a drop down, you guys are going to be able to configure what those are in the system. And yeah, contact type. And then you can choose, put in their phone, yep. Okay, then you're going to choose an episode type. And again, you guys are going to configure what those are. But right in this one, it's just intermittent continuous care, whatever you want. And then you're going to put the place of service. So again, you can have as many different place of services as you want. And then the client status. So you would probably want to put pending. So we're going to accept the client. So now hit the accept. Oh. Let's go back to see where it says state reporting race. That's turned on in the system. It's right down, like scroll down below the sex. Up, right over. See, you put in the date of birth. It's a male. Then just go over to the next column to the left. There you go. It's a little star thing. That wouldn't necessarily be turned on in your device, your system, but if it's required. So next, let's move on to the payer. And you can just choose the drop down. Oh, we don't have any in there. Oh, all right, hold on. Give me 2 seconds. I'm going to put in a Medicare payer. Just give me 2 seconds, please.
Yeah.
I don't ever play in this one, so.
Right. Yeah, you could do that. You can continue on, Paul, where you can on that screen.
Yep.
And then come back to the payer.
Yep. I think everybody that's only played in this has only done Medicare. So give me 2 seconds. Okay, so we're going to go back here. Let me get in the system. Okay, I go to Quick Intake Wizard. And your client is Bob Apple, right? Okay, so now you should be able to choose the bullet that says Medicare payers. So on the payer, choose that episodic Medicare.
Doesn't let me click it.
Hold on just a second. Let me make sure. Okay. Okay, get off of that tab and go to another tab and come back, and I think you should see what I've got in there. Now go back. Go down. Let me exit out. All right, go down to where it says Exit Wizard. Scroll down, see where it says Exit Wizard. Exit it, and then go back into his name. There you go. All right, now you've got the payer, but you're going to have to, where it says Medicare Admit Source, fill that in. Yep, and now when you go to Services, next tab, now you're going to see the services that sit on the payer. So that'll be set up by your billing department. So you'll only be able to choose what is on the payer. So if you guys have a PCA payer, PCA hourly and skilled nursing or an initial eval might be the only thing you see. Does that make sense?
Yep. And for someone who's Medicaid and we're just doing straight PCA, would it be a lot more streamlined, a lot smoother, a lot quicker?
Yes. Yep. It's just in this sandbox environment, we don't have any other payer set up. So then you hit admit. And then you can put in your admit date.
Get another payer set up so that we could try.
Yeah. Actually, you know what I'll do? I'll go in and add another BU that has all of the Medicaid payers in it. And now that we've walked through this, we'll let you guys play in that business unit. So before we hang up, I'll show you how you change the business unit so that you can play with that as well.
Okay.
Yep, so you're going to choose that hospice at home, yep, and the date, effective begin date. And just hit admit. So that's what it takes to get a client in the system. It's pretty easy, right? Okay. All right, so now let's go to the schedule and let's schedule your nurse visit, and then you guys can play on the device with the form. So if you scroll, if you do the up at the top where the little green arrow is, if you click on the, or you can schedule it right from there. So let's do it right from there so you guys can see. It should open, yep, there you go. So you're going to want to check that schedule assessment service code because that's the first thing that you're going to do when we start playing around down, yep, right second box in, down below Bob Apple's name. See where it says schedule assessment service codes?
Yep.
Check that box and then click. And if you scroll down, yep, RN assessment, and then scroll down. Keep scrolling and put your nurse in. You don't have to put a time in or time out because it's just a nurse visit, an assessment. You want to put in Mindy Nurse as your nurse. So you want to put in M-U-R-S-E and pick Mindy. I think it's Mindy or Melissa. Missy. Right. And then you're going to go up and save it. And so now, I think you guys are probably going to have an Oasis, but now you can do, get a new tab and open up your, the point of care. And you now then will have a form on the device that you guys can play with. That makes sense.
So, Kathleen, you want them to log into Clinical Edge now, right?
Yes, they can log into Clinical Edge if they want so that they can see. And then they, as long as they're comfortable with everything, then that we don't have to stay on the line for them to play with it.
No, I thought you wanted them to do that right now, but.
Yeah. Mm-hmm. Yep.
If I'm
Go ahead.
being the clinical to do sort of charting, or is that all in the continue link?
It isn't.
Say that.
So you always have to log into the clinical edge to do it.
If you're a field nurse, you do. If you're not a field nurse, if you guys just touch that green arrow at the top, it'll put the blocks back on the left. So, yep, if you click, go down to where the clinical and go to Notes QA. And put in Apple. And you see the drop-down box where it says Forms and QA Review. Change that to all visits and forms. And hit search. Include schedules with no forms. Yours might not have attached a form. Hold on, just give me 2 seconds. Let me attach a form. Give me 2 seconds. I'm gonna put a form on your visit because I don't think your visit has a form. That's the problem with the sandbox when it's, all right. All right, let me have you add a form so you see how to do a form. So click that little box that says add form. Yep, and put your client Apple in there. Yep. And then put your caregiver nurse. Yep, sure. And then hit the drop down. And so now scroll down and find a form you want to do. So if you want to do that start a care paraprofessional, you can go down and click that one. Yep, and hit save. And now go back. Yep. There you go. There's your form you can start playing with now. It'll look the same way here as it does on the Clinical Edge device. So it'll kind of give you an idea of how it is on the Clinical Edge device, if that makes sense. And I think you might have to hit the edit button at the top. I'm not sure if it's grayed out. Nope, you're good. You can start just doing whatever you want to do in the form.
Making changes.
Say that again.
What?
Yeah, it sounds like it's probably fine.
So, Kathleen, did you hear what he said? It's not letting him make any edits?
Okay, go back out and go hit search, go up to the, Go up to the top again and hit search. Close that. Hit search again up top. Oh, save. Hit save at top. That's why it's not letting you. Save. Okay. Now go back into the form and see where. Now go down and see if it'll let you make a change. No. Okay, hold on. Let me check on that too. That's the problem with sandboxes. All right. Let me get into
And would like private duty nurses or PCAs be able to use Clinical Edge in someone's home? That's the application they would use, like on a phone or an iPad or something like that.
Yeah, they use like an iPad or anything. Yep, and they'll have this form that they just go complete the form based on.
And then if a private duty nurse, let's say, just chart their daily notes, progress notes, vital signs, medications, event client, that's all done on Clinical Edge.
No, say that again, Paul. Repeat what you just said.
Yeah, so say a private nurse is at an event site in the house, and they need to chart their progress notes and medications given on the bar.
Yeah.
And
Yep.
vital signs. That's all done on Clinical Edge, all on a phone or an iPad at the house.
That is correct. Yes.
Okay. I mean, maybe even when you guys take control back, maybe could you show us that?
Yeah, that might make sense, Kathleen. Let's do that. Did you hear that?
No,
I'm going to give you back control so that we can just show them how to do progress notes,
yes.
like medications, MAR, or vital signs.
Yeah, it's easier. Yeah.
I'm going to make you presenter. Here you go.
All right. So I'm going to show you on my Clinical Edge, guys, because I just think it'll be a little bit easier to do it. Let me go back and see who I have. But you see the same thing in Clinical Edge, I mean on the Office. So Visit Hourly, I think, is a good one. So basically, when they get their schedule, they'll see their form sitting right here. And I'm going to roll it back. So this is that same form that you guys had. So if I recall the form, they have to put in their password. But just so you can see the form. Again, you guys have the option of changing the form, removing stuff, adding stuff, making it whatever you want. And the system will automatically pull over information for them. So when they hit edit, I'm going to scroll down so you can see. They can go page by page and complete things, or they can go section by section. So if I wanted to skip and go to the physical evaluation, then I can skip over and go to that evaluation section. So if I wanted to say, hey, there's no hearing problem, pain assessment, it's their right leg, and currently it's a 5. The worst it gets is a 9. The best it gets is a 0. So you can see if you use our controls, they can have as much information in them as they want to be. I think on this one, so this one, because it's paraprofessional, you know, what do they require assistance with? So they can check everything that they require assistance with. So again, you guys can use our controls, which are already built in, or you can create your own controls. Laundry, same way. Housekeeping. So just whatever you want on the form, you have the ability to put on the form. Let me see if vital signs is in section 2. So now we're going to the diet. You know, whatever they need for diet, adaptive equipment, fall risk, admission criteria. I'm not seeing the vital signs, but you can easily add the vital signs onto the form, and they can document vital signs as many times as you need them to. But this is what exists on our form today. We also have the frequency and duration. So this is where they have the ability when they do the assessment, if it requires doctor's orders, to say what services you're going to be providing. So if it's home health aide hourly and you're going to do 4 hours daily for one certification period, you'll be able to save this assessment and it will automatically populate the doctor's orders for you. So I'll kind of show you that too. Then we also have a section that's problem interventions and goals that, again, you wouldn't necessarily need unless you're going to be doing, and I don't think there's even anything in this one, but you can add problems, interventions, and goals if you're going to be writing doctor's orders for it, or you've got things that you want the ability to document against. So for example, we can create a problem intervention and goal that is hourly care that you address if they're not going to be using mobile aid, and this is where your nurse is doing shift work. And I'll show you on another client where you can put a problem intervention and goal in that basically says all the things that they have to do for that client so that they can document during that shift. The medication profile sits on every single note, every single form in our system. So it's there for the nurse when she goes out to do the start of care. She can start putting in her medication for the client. So that'll auto-populate. So you can say 1 tablet, 8 a.m. daily. What's the start date of that medication? So I think this goes back to January. Is there an end date? Is it a new medication? Is it a changed? What's the frequency? If it's PRN, they have to put what the purpose of the medication is, but he takes it once a day and saves it. That builds the medication profile here on the device. It also builds the medication profile in the main application for you. So as you add that information, that automatically exists on the device for them. If it's a client that you have to do the plan of care for, and we've built that in, then your clinician just comes and says, build plan of care. You can see that it has that paraprofessional assignment right there. So they just hit save and it will bring the applicable information from the plan, from that assessment over onto the plan of care. So your clinicians don't have to fill out the plan of care again. So if I go to frequency and duration, for example, because that's the one I filled out on my assessment, there it sits already. So your clinician then just can save, sign, and submit, and that'll come over to the back office to Notes QA in the back office. And so I'll show you that again, just so you guys remember that. Every form they go to sign and submit, if there was something that you said was required for them to complete and they didn't complete it, it's going to remind them, hey, you've got to go back and answer that question. So they just click on it and it's going to take them back to that question so that they can answer that question. So once they've got all the questions saved, yep, go ahead.
We can make those required.
Was there a question?
Yeah, Catherine.
Yes. Yep. Yep, on the control history. Yeah, on the control history, on that form, when I was showing you the forms designer, requiring the questions is what generates this, that these being not completed. So that's where they're going to have to circle back and answer that that question. And it's that one's telling me, hey, you put oriented and you put comatose. So it's telling me you created a mismatch that doesn't even make sense. So all of that exists in our system today to help you kind of get that right. So once they've got everything right, there's no errors, everything's perfect, then they can sign and submit it. They sign and submit it by putting in their electronic password. Their electronic password basically prints electronically signed by Kathy Spooner, RN, or whoever that clinician is on the device. So once they do that, then they're good to go. I'm going to show you one other client that I've got some problem interventions and goals on. So let me show you that one. I believe it's Susie. So again, when they have a visit note that they need to complete, and they go on that visit note, when they get to this section, and you guys again create the note any way that you want it to be, but if you've created problems, interventions, and goals, that's where they'll document what they did for that client. So if you had something that was like in a treatment record, let me go up and hit edit. So they could put, you know, vital signs performed, weighed client, or let's see, client weight is 130 or 127, and hit performed. It's gonna tell you, is this the right perform time? If I save it, they can look and see how that's been answered by all the nurses that are taking care of that client. So whether you're doing, if you're doing PCA, it doesn't matter. If you're doing skilled nursing hourly cases, you have the information at your fingertips. If you're doing Medicare, that information's at your fingertips. If you're doing the PCA, I'm then going to go create my paraprofessional, which flows to Mobile Edge that they document against the visit. So it's flexible for any different service that you could offer. Does that make sense?
Yeah. So what about for a nurse that's charting? They're on a visit or they're working with a 24-hour private duty nursing. When they're going through their charting, and if they hit like a body systems not within normal limits, does it flag them to expand on that?
You can set that up however you want it to be. So yes, when you create a control, so if you had a control that said within normal limits, not within normal limits, then you can create additional questions that they have to answer that are required, or you can create a comment box that they have to comment against. So it's however you guys set up the question to be answered on the device.
Okay. That sounds good.
I think I'm good.
I think that's all we have then.
All right.
All right, awesome.
Good deal. And listen, I apologize for the sandbox setup and stuff. Well, I initially mentioned that we don't do sandbox, and I think now you see why. I mean, there's so many different variables that we have to try to plan for, and since we don't have one, and trying to do it on the fly, you know, is a challenge. So I apologize for that not working, but I'm glad you were able to get and see what you needed to see for this. Gretchen, anything else clinically related that you think we need to circle back to at all, or are we good?
I would be curious just to see an intake for a different pay source.
Pay source.
Yeah, I'm going to go ahead, and I think I gave it to you already. Let me just check and make sure. I think you now can switch offices on your user, and there's different pay sources, but let me just confirm it. Hold on. Let me get everything squared away. I'll get it set up, and then we will let you guys keep the sandbox and have David ping you that you can go in, and you'll go up. Let me just show you where you'll go once I get it fixed. So once I get it fixed, up here where it says, let me get this out of the way, switch offices, you're going to switch offices, and you'll go to the one that says, yours is going to say home care. And when I get everything set up and you go to home care, it has, let me just verify, it has different payers in it. So you guys can play with that a little bit. But again, the payers are going to be dependent on what your agency, yeah, there's a bunch of them in here. It's going to be on what your agency puts in there, but I'll set it up where you guys can go into the other office. So you're going to go switch office, you're going to go to home care, and you guys can do a quick intake wizard with any of these payers that you want to do. Does that make sense?
Yeah, that's perfect. Thank you.
All right, so I'll get it set up, test it, and make sure it's working fine. And then we'll have David ping you and let you know you're all set to go.
Yeah, and Gretchen, remember, with anything, you know, you could call me and I might be able to step you through if you lose a step or where to click. Just let me know, okay? All right.
Sounds good. Thanks, you guys.
All right, you're welcome, guys. Have a good afternoon. We'll be in touch.
All right.